it's Paramedic Pat. Another installment of my stories of EMS. This one takes place in a Texas State Penitentiary. One of the things that we did was actually make transports out of several state prisons. Way back, the prison system had their own ambulance system. And then in a cost-saving measure, they decided to quit having all these ambulances sit at the various prison units and rarely ever get used. So they made a decision to start using the local EMS services. And we even had one of the captains or somebody come out when I was riding one of the rural counties and kind of give us a rundown of what to do and not to do while you're in the prison and things like that. So it made it quite interesting. We learned that if you were inside a prison and a riot goes down and they go to lockdown, you're in lockdown with them. If you happen to be in the prison at that moment, you're in lockdown with them until it's all clear, which could sometimes take a day or two. We weren't real happy about that. But anyway, my partner was a man named Mike who was a really good partner. He was a really good paramedic. A few weeks before this incident happened that I'm talking about at the prison, we had taken training on a new drug called adenocard. Now, adenocard is a drug that helps correct what we call SVT, which is called supraventricular tachycardia. And that's where your heart is just running away with itself. It'll be beating 160, 70, 80, 200 beats a minute, depending on the situation. Now, up until we started using adenocard, there was only a couple ways to slow it down. One was what we called the Valsalvo maneuver. And believe it or not, you'd have the patient bear down like they were trying to take a poop. And you were supposed to call it vasovagal stimulation, and that was hopefully slow your heart down. It didn't work very often. Another maneuver was called carotid sinus massage, and you'd get over here on the carotid artery, and you were supposed to take your finger and kind of massage it. And that never worked for me either. The only other thing you could do was cardioversion. And I did that once, and it does work, but it hurts the patient, and it's quite a scene to have to. Usually, people are still conscious when this is going on, so to shock somebody while they're still conscious is not something you normally want to do. So they finally came out with this drug called adenocard. They decided to carry it on the ambulance, and it had a very exacting way it had to be given, or it wouldn't work. Well, a couple weeks after we took the training and had the drug on the unit, we get a call at the prison. And like I say, it was a big hassle going to the prison. You had to go up to the Sally Port. That's the big gate where the vehicles drive in and out. And you had to go up to the Sally Port. And, of course, they were supposedly supposed to know we were coming because the clinic in the hospital, in the prison, the hospital, like say the hospital in the prison would call and tell them, but still you'd drive in and they would open up the doors and look underneath with a mirror and under the hood and everything, make sure you're not bringing anyone or anything in. And we would drive up, and the way we had to go into the prison was through the showers, the famous showers. And if you had a female partner, that was just too bad. All you could do was just, we'd always tell the female partners, just look straight ahead. Now, the guards tried to keep them quiet and everything, but they were all kind of cat calls and everything else. But luckily, on this day, we didn't, it was Mike and I, so we didn't have any trouble. Get back to the infirmary and go in, and then they had a little emergency room, little treatment room. And there was this, I don't know how old exactly he was, I don't really remember, but I think he was in his mid to late 50s. laying there on the gurney, and he looked horrible. White as a ghost. I mean, as pale as any white person I'd ever seen. And these two nurses who worked in the infirmary there during the daytime were very nice ladies, but they were very limited in what they were allowed to do to a patient. They knew he was in trouble. They knew that his heart was beating way too fast. So what we did, we went in and we saw that his heart was going right at 200 beats a minute in supraventricular tachycardia. And as soon as we saw that, me and Mike both looked at each other and said, adenocard. Now, we hadn't brought the adenocard in with us. It's a drug that we rarely expected to ever use, but here we were in a situation where it was indicated. So I told him, I said, you get the IV. The nurses were trying to get an IV on him, and when your heart's beating that fast, you've got low blood pressure, your veins aren't real prominent, and these ladies weren't really used to starting that many IVs. So Mike goes, I'll get the IV if you will get the medicine. All right, so I had to make the trip back out to the ambulance, through the showers, grab the drug kit, come back in. Well, by the time I did that, Mike had the IV going. Now, this guy was conscious, sweating, you know, what we call diaphoresis. It's not sweating from overworking, it's sweating from being in shock. And in his case, it would be what you would call cardiogenic shock. And the way you had to give we told the guy that we were going to give him some medicine that was going to make him feel better. Now, one of the things the adenocard does, the way it resets your heart is that it actually stops your heart for about 6 or 7 seconds. The heart goes to a systole. And then if everything goes right, it restarts back in sinus rhythm. Now, we'd never given it. We were just told what to do. So the drug had to be given very quickly into a good IV. And then you flushed it with saline to make sure that this bolus of adenocard got right into the patient's heart. So we got ready, and I looked down at the patient. I said, you ready? I said, you're going to feel funny for just a few seconds. Now, I didn't tell him that the funny part he was going to feel was his heart was going to stop. I didn't think that was necessary. So Mike and I get ready. He pushes the drug, I push the bolus, and we both start staring at the monitor. And sure enough, just like they told us it would, he goes into a systole. His eyes roll back in his head, and for a few moments, I honestly thought we killed him. His heart was in a systole, and then it seemed like eternity, but about 4 seconds later, we got a sinus rhythm indicated on the scope. This man's color came back to him immediately, pinked up as we call it. His level of consciousness was normal. And then he goes, wow, I feel much better. Instant relief, instant cure. And he says, do I still have to go to the hospital? Well, yeah. We gave you the drugs and everything else. We're going to have to take you to the hospital. Now, the rigmarole we had to do to take somebody to the hospital from the prison is a whole other story I'm not going to really go into, but a guard had to ride and all kinds of stuff. But anyway, in this case, the adenocard, the very first time we'd ever given it in the field, it worked just exactly like it was supposed to. So the patient was very grateful that we were able to help him. He was relieved in the fact that he was able to, feel well again. And we were extremely happy in the fact that we were able to actually really help him, that this new drug actually worked like we'd been told it worked. It wasn't always that way. So anyway, that's pretty much my story as far as our prison call with using adenocard for the first time. So maybe it's fitting that the first time we tried this drug was on a prisoner of the state, but I always treated the prisoners. I never knew what they did. I never asked them what they were in for. They even had, when we transported them, we had what they called their jacket. And it was paperwork that had all their medical history while they were in the hospital. And it had what they had done, what they were in for, how many years they were in. But I never read it. I didn't want it to possibly influence how I treated the patient, because as a paramedic, I did my best to treat everybody equally. And there's some other prison calls that got to be pretty interesting, and I'll tell you some of those as we go along. But anyway, we got him to the hospital, and everything was good. I assume the prison ambulance or transport or somebody took him back to the to the prison once he was well. That's something we didn't normally do that, but I'm sure they got him back some way or another. Never really worried about it. But anyway, that's my story of the day we got to try out adenocard. So it was a pretty neat experience. But anyway, that's my story, and I'm sticking to it. And we'll see y'all next week. Bye.